the service that is being cut by Santé Québec after much negotiation and after having providing the service for the past since 2019 is a support service for the teams who work in the designated centres.
The Montreal Sexual Assault Centre is ending a key support service for teams assisting sexual assault victims across Quebec after Santé Québec cut funding.
The intervention, the medical social intervention that's provided in a designated centre is a fairly complex intervention.
The intervention is intended to be consistent across Quebec, but expertise can vary, especially in rural communities where frontline workers may have less experience due to fewer cases.
It is complicated because it has to be done in a very organized and systematic fashion if we're gathering the forensic evidence. And because you want that evidence to be able to be used in a criminal proceeding, it has to follow the procedures and the rules.
Experts warn the cuts could weaken both the quality of care and legal outcomes for survivors if teams lose access to ongoing expert guidance.
All of this expertise was used to provide the support and develop the best practices to be able to respond to the needs of the victim.
Santé Québec told City News the agreement was already set to expire in January and did not include funding for renewal. They say the goal is to draw on internal expertise within the public health network to meet shared needs. In response to concerns about delays in service agreements, Santé Québec said it offered a temporary renewal to allow for a transition period, but that the offer was not accepted.
We made a decision that we couldn't continue in this sort of transition period to continue offering the service in the way that it was presented.
In Montreal, Adriana Gentile, City News.